The Ascension Healthcare Network says its clinical operations were disrupted Wednesday by a cybersecurity event. The company says it responded immediately and is working to remedy the situation. Ascension is one of the nation's leading nonprofit and Catholic health systems with 140 hospitals and 40 senior living facilities across 19 states and Washington, D.C. Ascension has also brought in a cybersecurity firm to help investigate the attack. It will inform patients if their data has been compromised. Our Homeland Security and Justice reporter, Nicole Sganga, joins me now for more. Nicole, what more do we know about the breach? And do we know what kind of data was compromised?
Yeah, John, we know this cyber attack disrupted the network of a major healthcare system and that it's impacted clinical operations. As you mentioned, 140 hospitals here, 40 senior care facilities across 19 states. Now, the company reported in May that it had 134,000 employees, including doctors who are now relying on paper records like we're back in 1980 or 1990. We still don't know how many patients were impacted or how much data might have been compromised, but Ascension did say in a statement today they'll notify and support any individuals impacted by this.
Now, this comes a few months after United Health Group was hacked. Any similarities, other than the fact they're in the same space, but any similarities between those two events?
Well, the fact that they were in the same space, I think, is important, and it underscores just how vulnerable the U.S. healthcare system is to cyber incidents. So vulnerable, in fact, top U.S. officials are actually predicting future cyber attacks. I sat down with HHS Secretary Javier Becerra a few weeks ago. He told me that every hospital, every doctor's office, and most importantly, every healthcare network in America should be asking themselves the question, are we next? Now, the attack on United Health subsidiary, Change Healthcare, targeted an IT provider. And today we're talking about a healthcare system. But because in both cases the networks took their system offline proactively, it impacted hospitals and pharmacies and doctors' offices' ability to do their business. And that's a really dangerous prospect when you're in the business of saving lives. In both cases, there are also concerns about whether sensitive health records have been compromised. And we know that in the case of Change Healthcare, there are individuals whose personally identifiable information were stolen by cyber criminals.
Just building on your point there, the threat intelligence company Cyble says there's been 105 ransomware attacks on the healthcare sector globally, beginning in February, 77 of them in the United States. What's up with our hospitals particularly vulnerable? Why are they a rich target?
Yeah, this is a growing number of hospitals now that have been impacted by ransomware attacks. Part of the reason the U.S. remains a target, we're a major player in the Internet of Things. What do I mean by that? Our healthcare systems, our records are largely digital. Our data is a ripe target for cyber criminals. And we're not alone in that. We've seen major cyber attacks hit the UK health system back in 2017, Ireland's health service hit in 2021, but the U.S. a massive target here. Another reason the U.S. has seen a number of healthcare acquisitions and mergers. Those kinds of moves often make the acquired companies more vulnerable to attacks because their cyber hygiene may not be at its best when they're about to get swallowed up by a larger company. And that certainly was the case for Change Healthcare. Their affected server did not have multi-factor authentication, that extra layer of security. The last thing here, as long as healthcare providers continue to pay these ransoms, and United Health paid a $22 million one in February, we're going to continue to see cyber criminals going after the U.S. healthcare system.
Right, fertile territory. 30 seconds. Any solutions here for either customers worried about their data or for these companies?
Well, I think the number one takeaway is federal law requires healthcare organizations to post online if there have been any security breaches that expose patient information. So if you're someone who is worried about your personal information being stolen by cyber criminals connected to one of these ransomware incidents, you should go on HHS's website and you can sign up for credit monitoring services. Many of the affected companies will offer that service to patients for free. Make sure that you are protected in that way, John.
Nicole Sganga in Washington. Really great, Nicole. Thank you.
Thank you.